So, okay, uh, I'll just share the screen. We finished the zones, right? Now tell me what were the zones. I will just, yeah, tell me the zones now. What were the zones? Four zones are there for OT. What were the zones? That is important. That's why I'm telling. Remember the zones of OT. That is important. Tell me what are the four zones. We discussed in the last class. You don't remember, guys?
Ma'am, protective, clean, aseptic, and disposal.
Yeah, yeah, that's the zone. Okay. The first zone is protective, second is clean, and third is aseptic and disposable. Remember in the order. Okay. And we discussed about the operation theater diameters and all, and about ventilation cleaning, and also what are the materials and how it has to be cleaned. That also we discussed. And a type of disinfectant also we discussed, that is high, intermediate, and low. If this you remember, okay, for exam questions. What kind of disinfectants, level of disinfectants are available? This you remember, okay? Note it down. Everyone note it down. What are the levels of disinfection? And we also saw chemical disinfection agents, and we were here other agents. So in other agents, chemical disinfectant, we saw formaldehyde fumigation. So while doing fumigation we use formaldehyde, okay. So what are the other agent which we can use for fumigation? That is aldicol, bacillocide, and bacillol. Okay, so these are what to say, other agents. You only have to remember the names. Try to remember the names. And for this one, and also we use ultraviolet radiation. You know that while preparing medication, also we use a kind of laminar flow to prepare the medication so that no infection occurs while preparing a medicine. Okay, so in OT also you have ultraviolet radiation for disinfecting the particular rooms. It is on for around 12 to 14 hours, and before using the OT, before 2 hours you switch it off and then enter to OT to do any kind of procedure. Okay, so that is ultraviolet radiation disinfectant for OT. And for microbiological monitoring, as we said that we either use plates or swabs to understand if there is any microbial growth in that particular area, okay, in the OT. So swabs are collected from various locations in the OT 2 weeks and cultured on the blood agar. What is blood agar? It is nothing but enriched bacterial growth medium. Okay, so in like we'll see that in that blood agar, if there is any microbial growth, we have to understand that the particular area is contaminated and it has to be disinfectant. Okay, so the areas where we have to take from where we have to collect the swabs is that the operation table head end, okay, and over the headlamp, walls of the OT, and floor below the head end side of the particular table, the OT table, okay. And the instrument trolley is the most what to say, dirty and what to say, infectious area. So that swab also we have to take. We also have to take AC duct ka swab because We all because that is the place from where air is getting circulated, right? So that particular swab also we have to take, and also microscope handles. So microscope handles, because we touch it, different person touches it, so that particular swab also we have to take. So in surgical instrument, uh, this probably most this whole thing is um, practiced in CSSD, okay, but we'll be also discussing about this in OT because it is important. And preparation of instruments of sterilization. First step is to separation of sharp instruments from the blunt instruments. Then it should be dismantled as soon as possible after their use. Yeah. So if you are having a sharp item and a blunt item, from that you have to separate sharps and the blunt items. Mostly the sharps are discarded, right? And the blunt items, whatever instrument is there, is gone for disinfection. Okay. And cleaning is removal of all dirt, organic matter from the instruments to be processed. That is like how you do. You just wash it, right? So whatever visible dirt is there, and the organic matter or proteins or whatever it is there in the particular instrument, that has to be washed in the running water. This can be done by washing the instruments with sterile distilled water or mechanical with ultrasonicator. Okay, so this washing can be done in two way. One is normal distilled water wash, and another one with ultrasonicator. Okay. Now manual cleaning means this is what distilled water wash. Okay, so manual cleaning includes rinsing of cold water to remove protein materials, brushing of item followed by rinsing it in clean water and drying. Mechanical cleaning is preferred as to minimize handling of decreases risk of exposure of infectious material. Yeah, so mechanical wash is also needed to take away all the infectious material attached into that particular instrument. Now, once after the wash is finished, we also have to go for lubrication. Now, lubrication, why we do? The instruments which we use, because of the matter deposited there, whatever, like whenever we use it, there used to be some deposition used to be there in that particular instrument. So for those particular instruments, we have to dismantle it and lubricate it so that it works properly. Okay. Laryngoscope. You people, those who are doctor, you people know about the particular instrument, isn't it? That laryngoscope we have to keep dismantled all the time. Whenever there is a need of use, we have to attach it and then use it, right? So when we use it, once after that, we also have to wash it and then lubricate it so that it works properly. Okay, so that is the reason for some instrument lubrication is very much important, but not for every instrument it is needed. And at last you will be doing packaging with like we used to do it with this green color cloth, right? So once it is washed properly, clean, dried, and lubricated, we will be packaging it with the either green cloth, or nowadays you also use a blue color type of cloth, I could say. Yeah, so that also we are using. Then we package it and then we send it for sterilization. Okay, so in sterilization what we see is, after decontaminated instruments are assembled, packaged and labeled. Yeah, also after packaging we also have to label on what date the particular instrument has been packed. Okay, and they are ready to sterilize. Sterilization is a process where which achieves the complete destructions of killing of microorganisms, including bacterial spores. Yeah. Okay. So now we have four type of sterilization process. Okay, So we will be seeing the names and little bit about how it occurs. Okay, so one is steam under pressure or sterilization, that is called as autoclave, and dry heat. And another one is chemical agents such as ethylene oxide or low temperature method, and chemical sterilant as glutaraldehyde 2%. So, steam under pressure one is autoclave only, where this is one of the safest method of sterilization, and basically in all the hospitals we use this particular method to sterilize any kind of instruments. Okay, it kills bacteria, spores, viruses, and fungus. uh, Over here the process is mentioned that you just study and you will get to understand. It is very easy. And one thing you have to remember for exam, this particular thing, autoclave instrument should be used within 48 hours. What is the time period for using a particular autoclave instrument? And the options will be given for you. You have to select the option. So 48 hours is the answer. Okay, note it down, guys.
Yes, ma'am.
Yes, ma'am.
Yeah, so this you have to remember. One mark question. And flush and high speed autoclave. This is almost like normal autoclave only. Over here, we use this kind of things, which is instrument where there is a hole. Okay, for example, you have cannulas, right? Cannulas can be cleaned with separately with RL solution. RL means ringer lactate. Okay, ringer lactate solution. With ringer lactate solution, you flush it and autoclave it. Okay, so this is for that kind of instruments. And dry heat sterilization, yeah, this over here it is written it is less preferred. Most of the hospital do not prefer it because it's for the reusable glasses and metals and instruments and ointments. Okay, oil, ointments, and powders. So it is not used most of the time. So next is low temperature sterilization. Two type of sterilization is there for this. One is ETO sterilization and another one is plasma sterilization. So ETO sterilization means ethylene oxide gas to reduce the level of infectious agents. Okay, and plasma sterilization sterilizes the items with oxidation, and it produces reaction in which microorganisms are deactivated. Okay, so in chemical sterilization we have Sidex. Just know the name, that is more than enough. And other specification. So what are the other specification? Once the instruments are autoclaved, all the items has to be labeled and sterilized. Once the sterilization is done, like before itself we have to write the date, and also we have to mention the on which date the sterilization happened, right? Because if we don't know the date of sterilization, how would we know the expiry of that particular date, right, in a particular instrument? Because we can only use it for 48 hours, isn't it? So every sterilized item has an expiry date, yeah, that is for 48 hours. And items must be inspected before use to ensure there are no tears, punctures, open seams, moisture, soiling from being dropped on the floor, etc. So why? Because when you do autoclaving, no, if there is a tear in your cloth, which is like in the packaging, or there is some hole or there is moisture, it is not dried properly, then the autoclave is not done properly. So that is why before putting the particular tray into the sterilizer, you have to check whether it is completely dry, there is no moisture, there is no water, there is no hole in the particular packaging cloth. Okay, once package has been opened, it is no longer considered sterile. Yeah, remember that. And how you open it? You open it with one hand. One hand is sterile and another hand is unsterile. So you would be doing it with one sterile hand, from where you would be taking the instruments as well for the particular procedure. Okay. So once it is open, no, it is no longer considered as sterile. So it is ultimately unsterile. And do not once don't store non-sterile items along with the sterile items. Yeah, so that creates a lot of confusion. That is why we do not store an open package, the open trays with sterile items. Okay, if the sterility of an item cannot be assessed, it must be re-steriled or discarded. For example, you have written a particular date into it, but while doing autoclave, the date has gone. Okay, due to some reason, the date is not properly visible. At that point of time, you should not be sure that it came from what to say, CSSD, so it must be clean only. Unless you identify the date of that particular tray, you should not use it. You should send it back to the CSSD. Okay. A well done surgery can be spoiled by infection. Yeah, you know why the readmission rate occurs a lot once the surgery is done, because the person who got surgery, who has who has gone through surgery, that person has got infection, so he will be coming back to hospital again. That is not a good thing for a hospital, neither for the surgeon who practiced it, right? So there must be problem in the OT sterilization. There must be problem in the instruments, or must be there is some problem with the doctors or with the nurses who did not maintain infection control protocol. That is the reason infection is occurring to the patient and he is coming back for readmission, right? So it is always needed that while like in OT, the cleaning has to be very much proper, and it has to be disinfected every time. And infection increases the cost of both for the patients and the hospital. Yeah. So readmissions and treating that person with proper with that in antibiotics cost a lot. It is not a burden only for the doctors or for the patient, but it is a burden for the doctors and as well as the hospital. Okay. So OT sterilization and proper instrument maintenance can provide a infection-free environment and quality care for patients. So this part is completely about the process of sterilization, how the sterilization should happen for instruments in the OT, and rest thing is about operation, how OT works. So this is there in your notes, which is given in the ERP by Sangeeta ma'am. Okay. So two things are essential for an operating theater. One is your sterility, and another one is your teamwork. Okay. So, teamwork in the sense the manpower, how they are communicating with each other and how they are conducting surgeries, uh, and how they are maintaining the sterility of the particular of that particular OT suite. Okay, surgery is not a work of one important person, the surgeon. Yeah, so the team has also has to be involved into it to carry out a good surgery, right? uh, with a few other people who are not so important doing what they are told. Yeah. So people think that it is not important, like on the surgeon is the sole person who would be taking care of each and everything. No, that is actually a teamwork. For a successful surgery, it is always the teamwork has to be good, then only it occurs in a good way. The OT technician, the nurse, the scrub nurse, and the running nurse who would be taking care of other things. So all these personnel are very much important. So it is the work of whole team, yes, and everybody in the teams is equally important. Although obviously the surgeon has had a longer training than others. Yeah, but it doesn't mean the surgeon will be having longer training, right? The person who, like the nurse who is what to say, Assisting the surgeon also would be having ample amount of experience because she had handled a lot of surgeries than the surgeon, because many a times I have seen those surgeons used to make mistakes and he used to forget gauze inside the patient, but nurses makes that person, surgeon remember that that particular gauze is there inside the person and you have to remove it. So before closing the wound, they have to remember whatever gauze pieces are there inside the person while doing surgery, and they have to take out everything. And otherwise, there might be septic problem. The theater team should be a leader who takes responsibility for organizing the work, making sure all the routine jobs are done regularly. This ensures both the safety and efficiency of theater work. For regular operating, list of basic personnel required: a scrub assistant who to look after the sterile instruments and to assist the surgeon. That is a nurse who is experienced in OT. So that person is called as scrub nurse. Yeah. So an anesthetic assistant to give a local anesthesia, prepare the patient if required, the help of any general anesthesia. Yeah. So depends what kind of anesthesia it is needed for the particular surgery. So anesthetist is the person who would be taking sole responsibility of deciding what kind of anesthesia is needed for this particular patient. Okay. So a circulating nurse, I say running nurse, so that is the person who would be cleaning and sterilizing the instruments. Okay, sterilization part doesn't happen in the OT, but once after cleaning or drying, you send those packaged items to the CSSD for sterilization, and it comes back to the sterile room, which is attached to the OT, that you can what to say that you can use again for next surgery. Okay. And a general assistant, and a general assistant would be housekeeping or something. Okay, so that person is assistant who would be taking care of other clerical activities. Okay. And the registers which are mentioned which are actually maintained in the OT. One is operation registers, where you would be writing the name of the patient, about the identifiers of the patient, and the surgery diagnosis, and the name of the surgery, and all the details whatever is needed for surgery. Those details you will be keeping in the operation theaters and the dates. And in the register regarding abortion and pregnancy, so that means like we'll be seeing in the MTP Act. In that it is very much needed that all the necessary information of abortion and pregnancy has to be recorded properly. And also in the PNDT Act, we saw that any deficiency regarding documents, there will be a problem, right? So that is why in these particular cases, it is very much abortion and pregnancy. It is very much needed that all the documents has to be maintained properly and details has to be there. And a register for foreign objects. Foreign objects means what? Which objects we are talking about? Can you people tell me which foreign objects we are talking about here, guys? You people slept or you people are there?
Yeah, yeah, yeah.
Yes,
Huh?
ma'am.
Yeah, tell me what is the foreign object over here? We maintain one register for foreign object. Why it is needed in OT? It was there in your Sangeeta ma'am's note. You have studied, I guess. So why it is needed? Why the foreign object register is needed?
Ma'am, to keep a record of the
थोड़ा जोर से बोलो.
uh, ma'am, to keep a record of the foreign bodies that are being removed from a patient's body.
Yeah. Joydeep, right?
Yes, ma'am.
Yeah, yeah, true. So, for example, if we have calculi in your body, that is considered as foreign objects only, right? So, calculi, those part, and for example, you have previous surgery happened for the particular person, but some instrument has was there in that particular patient. It happens, you know that, right? So, and then you go for another surgery to remove that particular object from your body. That is also considered as a foreign object. And any accident
Ma'am,
happen,
bullet.
huh?
Ma'am, bullet.
Yeah, bullet.
Bullet.
Bullet is a, yeah, good example. Who's that?
Ma'am, Naeem.
Yeah, yeah, good. That's a good example. Bullet is a foreign item. And for example, any accident happened, right? Something went inside and then it broke in the middle. Okay, so it is still inside. The particle is still inside, so that you take out while doing the surgery. That is also considered as foreign object. Now for this register you have to maintain the type of object, what kind of object you have recovered from the patient body, and size of that particular object, and on from which particular organ or which part of the body you have removed. So those details you have to mention, okay, in this particular register. Okay, and there is to be medicine register. uh, um, Dipanjali, can you tell me what is there in the medicine register in OT? Can you tell me?
Ma'am, she is not there.
She's not there. She was there, no? I saw her. She was there.
She went to the campus, I guess.
Okay, okay, all right. So no problem. Okay, I can see Amina. Amina, I did not get your this one. I did not get your assignment. Okay. So medicine register. Who can tell me what is maintained in this particular register? Do you have any idea what will be there? In all the wards and emergency area, we used to maintain one medicine register, that is emergency medicines. Okay, so basically we write down all the emergency medicine which is there in that particular area. Okay, in like for example, if it is a ward, there also we have to write whatever emergency medicine is there, we have to note it down in that particular register. And we have to keep a record how many medicines are there, how many quantity you have to write, and you have to check it every day. So for OT also there is a register for medicine, where these medicines, whenever there is a need, you no need to ask the patient to get it or indent the particular medicine, you have to use it then and there, right? The that time of administrating that particular medicine is very less. So what you do is you keep a stock of it inside your particular area, and whenever there is a need, you administer it in an emergency basis and indent it later to replace the particular what is that replace that medicine. Okay, on that patient name only you indent, but on the time of emergency you use it from your stock. So that particular stock medicine register is maintained even in OT. Okay, and specimen register for biopsies, that is also needed, because anytime when you uh, uh, take out any sample for biopsies, and that biopsies would be sending you would be sending to the labs, right, for examination. So that register also we have to mention and send that register to the lab with the biopsy sample. Okay, and you get the sign from the lab, that this particular biopsy sample has been received from OT. So and over here you have the particular like all the detail, name of the patient, all the double identifier, what kind of biopsy is it, in which lab you are sending it, sign of that particular person. So this is there in the specimen register for biopsy. Okay, and you also have to maintain one death register, because many times it is not necessary that while in OT there will not be any death, right? There will be death for sure. So in that death register you have to mention everything about the patient, cause of the death, particular patient's details and diagnosis of the particular person, everything you have to maintain. And this particular death register also used to go to MRD for checking. Okay, and keeping of reports, full reports of every operation must be kept. For example, full name, surname of the patient, date of operation, initial and surname of the surgeon and assistant who assisted him or her, and anesthetist, initials and surnames, type of anesthetic administered, whatever anesthesia you have administered, local, general, or another one is there, local, general, and I don't remember the particular anesthesia name. I'll tell you. But one is local, which you particularly on the superficial area, you put that local anesthesia, and then general anesthesia is for whole body, and for some parts, if for example you give that's okay, sorry, that is spinal anesthesia, where in particular parts only they would be administrating. For example, in pregnancy, the lower part you need for this one. What is that? Anesthesia is needed. On the upper part, there is no need. So at that point of time, you only would be tranquilizing the lower part of the body, right? So that kind of anesthesia, you have to write what kind of anesthesia you have administered. Okay, and operation done, amount of swabs used, drainage tubes, suturing material, and catheters used. I say, right, you have to remember how many swabs are being used, how many suturing materials are used, and what kind of catheters, and how many it has been used. Everything you have to note it down. Okay, nurse, about the nurse also you have to write the details who has assisted, and circulating nurse details also you have to write, and time of the starting of the anesthesia, and the time when the person recovers, that also has to be maintained. Okay, now we also would be seeing how many types are there for OT. So there will be three types. One is in one, like the single theater will be there, where only one particular theater will be available, and in second one there will be twin theater. For example, one is minor OT and another one is major OT. Okay, so two are at the in a same suite. Okay, and there will be three or more OTs. I have only seen three OT at a time, and more OT in a same OT complex I did not see yet. So that is a bigger OT. Over there, all these facilities are there inside itself. So you have to remember the categories of operating theater. Okay. This is for today. I'll be sending this particular document to your WhatsApp, and as well as to I'll be uploading it into the ERP. Okay. So for today, you can take a break of 15 minutes or so. I'll be ending the class here. Okay.
Okay, ma'am.
Okay. So yeah. So we can go for lunch. Okay. Thank you.
Thank you, ma'am.
Yeah.
Thank you, ma'am.
Thank you, ma'am.